Go.
I'd like to have a quick comment. I do support the governor's bill because I'm desperate for some relief. I've been working for the government for Hennepin County for 10 years. I haven't had a raise in 6 years. I can barely pay my mortgage. I can't get a new furnace. My furnace is 15 years old. I have a 15-year-old car. I don't know how you expect the middle class to invest in the economy when I don't even get a raise. I take that back. I got a raise, a cost of living raise this year, and with the new taxes, I'm making less because of that my health insurance went up and my taxes. And now I'm making less than I did last year. I have a student loan I have to pay. I can't make my mortgage. I can't buy a furnace. I can't buy a new car. I don't know how. I'm so desperate for some relief. And all I hear is he's offering some relief. So I'd like to hear what you propose. Instead of disagreeing with this budget, I'd like to hear some relief for the middle class. Thank you. Thank you for this opportunity.
Could he please repeat his direct number?
651-556-6003.
Thank you.
Sweet.
Yeah. First of all, I'd like to thank Commissioner. Margaret, thank you very much. And I'd just like to say, the governor's proposal is transparent and it's balanced and it's not putting us into deficit. While I don't agree with a lot of it, I do agree that the final budget will be transparent and will have no shifts or gimmicks and will be balanced into the years into the future. So we're not in this chronic deficit cycle that we've been in the last 10 years, going from deficit to deficit to deficit to deficit. Families can't plan, school districts can't plan, businesses can't plan, communities can't plan, and it's time for that to stop. So whatever the end result is, it'll be transparent and it'll be balanced, and hopefully it'll put us on the road to a much greater Minnesota.
Representative Rosenthal, can you specify what parts of the plan, as far as taxes and spending, that you don't support?
Parts that concern me are the business-to-business tax. I have not gone through every page of the governor's plan, but that was the one that jumped out at me first. And I just want to make sure that we are giving our small businesses the opportunity to thrive and grow and to hire people. And so that's my concern. I have other concerns as well, but that's the one that pops out first.
Thank you everyone for coming. It's beyond 7, so if Senator Franzen has any closing comments.
Thank you, Steve, for doing this. I really appreciate it, and you've done a fantastic job. And again, we're going to change the format here and there, but we want to make sure that we're accessible to you, because this is a really complex area too, the budget, that you know the areas and that you feel comfortable expressing your concerns, and you have been, because I've been hearing from you all a lot, which is great. So we'll keep this conversation going. We'll have the next town hall in Edina on the 23rd. It's a Saturday, and we'll change the venues and timing so to make sure we reach as many of our constituents as possible before this is said and done at the end of May. So thank you for coming, and I hope that this was helpful. And again, please keep sharing your thoughts. There's a survey that our office put out, so if you care to share that with us, that would be helpful as well. There's some questions there, particularly addressing some areas of the budget that we're still looking at. So thank you again, and looking forward to seeing you next time.
And 91% of all the non-farm jobs that have been gained since the recession have come through a staffing or recruiting firm in some form or fashion. And what that shows you is that if there's going to be a recession every 7 years, companies want to be nimble and make sure that the need is really there. They're going to try before they buy. Same with the employees. Over 50% of the employees think they have taken the wrong job within just a few weeks of being on the job. So it's a good way. It's a bridge to employment for regular full-time. So this new tax puts a real damper. I think the jobs recovery is fragile. And to go out and tell all our customers right now there's a new 5.5% increase in our bill rate would be detrimental. And the fact that our bill rate is 68% wages that we pay to the employees already, which are already taxed, and then 16% of our bill rate is taxes on those wages, Social Security tax, Medicare tax, federal employment tax, state unemployment tax, all of those things, leaving only about 15% left in margin for us. So when we tax our bill rate, we're taxing a lot of things other than what we consider to be services. And so it doesn't really make sense, you know, to lump us in with everything as a business service when we're paying wages and taxes. We're really a bona fide W-2 employer. We're an employer of record. Our firm put out 2,104 W-2s last year right here in Bloomington, Medina. So it's a sizable employer, and I wouldn't like to see us be taxed for that.
I'd like to answer this question.
This is a good question.
Could you
because
have the person who has the question speak in the microphone?
Oh, sure, yeah,
So
but in
we
the
all can
future,
hear it?
great idea, good idea. And then, so in the future, if you have a question, come on up and say in the microphone so everybody can hear. You know, it's funny, and that's one of the difficulties that we found, one of the complexities in terms of what is a service. And for example, in the banking area and in the brokerage area, we extended the sales tax to banking services for consumers and brokerage services for consumers, but not banking and brokering services business to business, because so often, many times, if you're in a business, I used to run a business, you might negotiate a line of credit or some kind of a banking facility with the bank. Well, that's all negotiated in the rate, in the interest rate or the charge that you get. So the fees that go with that are bundled, and it's really hard to pull out what are the fees. If you're going to charge a fee, or the service, I'm sorry, if you're going to charge a tax on the service, what exactly are the services there? And we found the same thing in the employment area. We were looking at your specific industry. That was brought to our attention about a week or so ago, and we're analyzing sort of what is the definition of the service that's being provided there. So that's an example where your comments are, I think, will be helpful in us looking at that.
Excellent, thank you. Jan Schneider?
Yeah, my question is relative.
I could repeat the question too. Everyone can hear me fine? Can you hear me well? Okay. Go ahead.
My question was in regards to the healthcare exchange program, and I'd like to know more about how it's supposed to operate. Will it be good for small business owners? And can you just tell us more about the implementation plan? Thank you.
I can start off with that. I'm actually on the Health and Human Services Finance Division Committee, and we're gonna tackle the exchange bill on Thursday. So I've read it, and it's complex, and what I can tell you at this point, it sets the stage. There's a lot of unanswered questions. There's still more bills to come to give it more, put more meat in the bones. It's a work in progress. I'm still also looking through it, and whether it's, I support a Minnesota exchange. Let's start with that. I support a Minnesota-based health exchange exchange. A lot of companies, small business, large, we prefer to work with something that Minnesota can control, if you will, versus having the federal government come in and give us their rules and their plan and let us just use their framework. So having said that, it could look so many different ways. And you have about 12 or so, a dozen or so states that are working on it, that are moving forward to actually having their state-based exchange. I think most of the states are actually going to use a federal one because they're not ready. And one thing I have to say, kudos to the Commissioner of Health and Human Services, Lucinda Jensen, because they've been working their tail off on so many different aspects, from the Medicaid expansion, which is part of a decision that we have to make, and that's actually going to be on the Senate floor on Thursday, to expand Medicaid up to 138% of the poverty level. That's something that I also supported. We're expanding it to more Minnesotans. We're getting federal dollars coming into Minnesota. We decided not to. We wouldn't have that. So Minnesota is ahead of the game, I would say, in a lot of areas. And Minnesota Cares one program that we've had in place and that we're working to tweak to actually be able to comply with the new framework. And I know this is all probably a different language to most of you. It is to me too. I'm learning as I go, but it's something that I think is very important, that I think more of us should be educated on it, because it has huge implications to not only small businesses, but to everybody in this room. It's going to change, or it's going to be a different marketplace, and we all have a stake in that. I'm concerned at the cost. frankly, because there's projections that it's supposed to lower costs for small business, which, you know, it's fine that that's a projection, that's expected, but I'm still skeptical. We want to make sure that that actually comes through. So it's going to take a lot of work to make sure that that actually comes to fruition. But it does, it is a framework, it's a law that we have to work with, and we're trying to set the framework. So at the end of the day, I think it's positive, but it's going to take more than a year in a session to really make this work, I think, in my humble opinion. But there's a lot of decisions that need to happen really, really quickly, and it's very complex, and most people have no idea, and not for their own, not because it's their fault, it's because it's complicated, and we've been neglecting it for the last couple of years. This law's been in place for 2 years, and we haven't really talked about it for political reasons, and I think that's is a disservice to all of us here. So my commitment is to understand it as much as I can, and to be able to bring the perspectives to make sure that it works, that it might not be perfect, and it's not going to be right now, and it's going to be a work in progress, like I said, but we really need the best and the brightest to give us input. So I'm hearing a lot from all aspects, all stakeholders, physicians, providers, insurance plans, big and small businesses. So I'm there to do the work and to understand how we make sure that this actually works. But it is expected to be a positive for small business. At least that's how I've been, that's my perspective at this point. But there's more to come, and certainly I'll keep that in mind, because we need to make it work for small businesses.
I would agree with Senator Franzen. Minnesota is way ahead of the curve, and we're very lucky that way, but it is a fast-track bill. If we don't do it at the state level, we're going to have this big federal plan dumped on us, and I don't think any of us want that. We want the best plan that we can craft, and that's what we've been doing in the legislature for the last month. Last night we passed medical assistance off the House floor. Can't tell you at what time. But it's going to save us a lot of money, and it's going to cover a lot of people that need to be covered. And I've always been of the, I've always thought that, you know, preventative care is what we need. It's the cheapest, and it's best that everybody is covered, because if we don't cover everybody, we're all paying for everybody in the form of emergent care, and that's the most expensive form of health care that there is. And I've heard this bill twice, once in civil law. I'm not a lawyer, I don't know why I'm on that committee. But we heard the data practices aspects of it, which I had some concerns about, but which we're tightening up. And it, you know, it gives private insurance companies a whole new pool of clients. And so I've been hearing from doctors, from hospitals, from insurance providers, that they all are buying into this, and they want it to work, and that they're going to be working with us to make it the best plan that it can be. And I'm committed to that, and I think in the end it's going to be a good thing for Minnesota, and I'm going to continue to work on it.
Sure.
I just want to add that we have just released a great infomercial. Minnesota Management and Budget is managing the development right now of the healthcare exchange for state government. So we have a nice infomercial on our website, mmb.state.mn.us, or you could Google Minnesota Healthcare Exchange, and you could find the infomercial there that tells you what it is and how it will help you, and how you will access it come this fall.
Thank you. Judy, listening?
I'm Judy. I'm Judy Listening. I'm president of LifeWork Services, or provide services to people with disabilities. And my question kind of drills into the healthcare exchange and healthcare law. Do you support covering autism, given that there's so many more children with autism and we have adults graduating with that? So do you support the health plans and the exchange covering autism, especially for early intervention?